2021 was quite the year for both healthcare and healthcare IT. We saw a number of new IPOs and companies going public, as well as a massive increase in the amount of startup capital that was funneled into the system. Various estimates put that between 29 billion to 57 billion, depending on what metrics you're looking at. But regardless, it just shows that there has been a tremendous amount of interest in helping to catalyze new models of care and utilize technology to improve how we are actually delivering care in America. A lot of this was precipitated by the pandemic and all the problems and inefficiencies that the COVID pandemic has revealed to the general populace that many of us that were working in the industry beforehand were already well familiar with. At the time of recording, the entire health tech industry, if you're looking at the public markets, has recently lost around $190 billion in value based on certain analyst numbers. This has been driven largely by the 7% inflation that we saw in 2021, as well as the corresponding federal interest rate hikes that the Federal Reserve has been discussing for the past week. Last week, actually, they had their big meeting where they have determined that they will be raising interest rates at least 3 to 4 times over the next year. What effect will this have on an already slowing market? And what effect will it have on the startup community and what new ventures are actually receiving funding to pursue fixing certain problems in healthcare? That's what we'll be looking at today. Welcome back to the Chilmark Research Channel. My name is John Moore, and I'm a vice president here at Chilmark. Before we jump into things today, please be sure to subscribe to the channel so that you receive updates when we post new content. And if you like what you see, please give us a like and leave a comment. As many of you are aware, the startup and health tech ecosystem has been booming for quite a few years now, and each year more money is getting funneled in. What we saw with the COVID pandemic was even more interest because, as noted, many problems in healthcare were much more present and much more exposed through the sudden surges and the increased utilization of the care system. What this led to was a massive investment in new insurance providers, as well as new telemedicine, as well as care management organizations. Pretty much anything that would allow hospitals to provide more remote care and less in-office visits was a big darling for the investment community. A major contributor to all of the hype and all the investment that we have been seeing in the health tech space recently has been largely due to the impact that the COVID pandemic has had on exposing various disparities and inequities in care delivery, as well as problems with accessing care. This led to a massive influx in capital for virtual care providers, as well as new insurance plays where they were providing a decent amount of the remote or concierge primary care. A lot of this investment was driven around the need to reduce the amount of burden on overtaxed large healthcare organizations that were basically at capacity for their beds during a lot of these pandemic surges that we've been experiencing. So what this led to was a shift to more remote care, and therefore venture capital, PE, all of the people with money were getting excited about the opportunities for these new platforms that were suddenly seeing increased interest from actual buyers on the provider side. However, in the middle of 2021, we started to see society return to normal, and suddenly all of these telemedicine companies and virtual care companies started losing their value very rapidly because their actual utilization by patients dropped precipitously. As healthcare organizations reopened their doors and started to attempt to return to business as usual, the actual utility of these telemedicine solutions were no longer as viable as patients actually wanted to start seeing their providers in person again. So what we will be seeing in the year ahead is most likely a significant decrease in interest in a lot of these telemedicine players, other than the ones that are showing really strong results and really strong buy-in from the end users and the hospitals. What we do expect to see in the year ahead is a much bigger focus on true ROI for these solutions. So basically anything that is affecting the finances as well as the operational side of healthcare will probably be of significant interest because those are still some of the areas that are weakest in light of surges. One of the big areas in 2021 was also a focus on addressing health equity and disparities in care by looking at social determinants of health and what the actual healthcare providers could potentially do to address ongoing SDoH problems that were impacting patients' ability to stay healthy or adherent. However, a lot of these SDoH platforms, while well-intentioned, are very difficult to truly measure the ROI and the impact on the bottom line for care organizations. Complicating this is a renewed resistance to the shift to value-based care, as evidenced by the very tepid growth in ACO organizations in 2021. I think it was only something like 6 new ACOs were added to the CMS list in 2021, which was a substantial drop-off from the previous years. Another area that has largely been driven by the shift to value-based care has been the investment in new virtual care management models to help patients living with chronic disease better manage those illnesses to reduce unnecessary care. But again, without those VBC initiatives, what's the point? We all know that it's important to address these long-standing chronic conditions, but if a hospital or a care organization is still billing fee-for-service, they get more money if they're treating more often. So again, we've been seeing massive valuations and hundreds of millions of dollars worth of investment going into individual care management platforms, and I think we can expect that to drop off as well. This doesn't mean that there will be an end to the IPO market for these types of solutions, but the 75+% drop in value that we've seen in companies like Teladoc and Livongo will probably carry over to other investments and make investors more wary of putting their money into these spaces. Companies that do have traction and have shown success in their ability to retain customers over time will probably be able to go into IPO this year, but it is definitely less of a guarantee. So I've reviewed where the opportunities were last year that are looking to dry up or potentially be stalling out a little bit. So what are the opportunities for the year ahead? Because obviously healthcare is going to continue moving forward and there's still a lot that we need to fix and a lot that IT can do to help with that. After numerous internal discussions with the Chilmark analysts, it's our belief that there are a few specific areas where we can see growing hype and growing interest. One of the areas in 2021 that we saw huge problems with was staffing shortages. The visiting nurse model, while effective in emergency or crisis situation, is not tenable for long-term ongoing surges that you can't really predict because it's just too expensive. So what we can expect to see in the year ahead are new models of flexible staffing that aren't as expensive as the current traveling nurse model and are probably more geographically localized so it doesn't require as much travel from the actual employees. Staffing shortages are just one operational issue that we'll be focusing on in the year ahead because of how much opportunity there currently is to fix healthcare in this regard. So as we look to artificial intelligence and machine learning, there's currently a lot of resistance for clinical utility. However, there is significant buy-in and acceptance for operational requirements. What we see in the year ahead are new tools for revenue cycle management to alleviate the back office burden that a lot of organizations currently face. If you look at some recent articles, we're actually seeing that burnout is being driven simply by administrative needs. And this is turning people off to their healthcare careers and leading to further resignations as part of this wave of the Great Resignation. So where do we see AI currently being utilized in the year ahead? Expect to see command centers for hospitals receiving more investment and more robust offerings. Expect to see new triage offerings that can help organizations better screen for alert fatigue and to reduce the number of alerts that are actually seeing their way through to clinicians. This is going to be a huge part of reducing burnout because the actual clinicians can only focus on so much at any given time. So helping them focus on what really matters will be a boon for productivity. We can also see companies like Hospital IQ and LeanTOS seeing greater traction around their resource management offerings, specifically getting patients in and out of ORs more efficiently so that there can be more elective surgeries again, since those are such profit centers for a lot of these hospitals. In the interest of improving access to care and reducing disparities, we can expect to see more focus on enforcing the No Surprises Act, which last year was very minimally enforced and had quite a few scandals exposed around hospitals and other organizations blatantly hiding their fee structures. So as we look at greater enforcement, you can expect to see greater investment in solutions that are actually enabling care organizations to provide this data to patients ahead of time. This will help solve many of the issues that patients face around accessing care just because they don't know what to expect to pay, and it puts them off and scares them away. Not only did we see additional strain on the healthcare system last year, but we'll be seeing even more strain in 2022 due to the increase in new patients that are signed up for health insurance through the ACA exchanges. This was largely driven by the COVID response bill that included new subsidies for patients that had previously been unable to afford the premiums for basic health insurance. However, with 2022 being a midterm election year, we're going to have to face, as an industry, a lot of political posturing and a lot of political. So let's look at both parties and what this means for each of them. The Democrats didn't get many wins in 2021. They had a really rough year and infighting and just were unable to accomplish a lot of the goals that they set out to achieve. They really need a win in 2022, and that boils down specifically to these subsidies. If they are not able to bring these back in new legislation, then they are going to lose the trust and faith of their party and of their constituents, and they will probably lose their dominant seat in the Hill. Republicans are also going to need to thread the needle here and tread cautiously because it is obviously to their benefit to undermine any of the Democratic efforts here, but they don't want to actually let it be known that they are trying to degrade their own constituents' access to care. So this will be very interesting to see how it plays out in the year ahead and what actually happens in terms of new legislation to fund access to care. Recently, there's been a decent amount of skepticism about the actual valuation of companies that are serving the Medicare Advantage market. And I think that we can see these valuations further at risk as we deal with the political fallout of the year ahead. In closing, 2022 will be a very different year than 2021. We see the public market slowing substantially, which will reduce the number of IPOs in the space because of this pending global recession that we all kind of foresee due to never really feeling an impact from the COVID economic slowdown. What we do see as opportunities is around the startup space for new solutions that can vastly improve operational functioning for healthcare organizations, specifically addressing the issues that are leading to burnout for a lot of people. This is looking at supply chain management, revenue cycle management, and staffing. So any solutions that are going to be able to supplement the care being provided by helping to reduce the back-end burden on providers and their staff are going to be very viable and smart investments in the year ahead. The only issue that we really see plaguing this industry that we can't predict now is what will be the fallout from the political posturing and the political mess that will be the 2022 midterm elections. If you like what you saw here today, please give us a like and subscribe. And if you want to leave a comment to engage with us, please feel free to do that as well. Thank you for joining us today. We look forward to seeing you next time.